Good afternoon. My name is Marian Levy. I'm a professor and the Associate Dean at the School of Public Health at the University of Memphis. I'd like to thank the Academy for inviting me. I'm honored to be here and hope to contribute to the conversation. I'm going to talk about an environmental approach to promoting a culture of health in a university setting. This was called Memphis Healthy U. It was a three-pronged approach to move more, eat healthy, and be tobacco-free. For today's presentation, I'm just going to focus on the first two. So this is how it got started. The University of Memphis had a health fair in 2011, and I showed the demographics because it mirrors the general population of the University of Memphis. And we were surprised at some of the health outcomes, the immediate obesity outcomes, and the chronic disease implications. Of the 240 individuals who completed the total screening, 47% of the students were overweight or obese. In terms of systolic blood pressures, 42% of the students who were screened were pre-hypertensive or hypertensive, and 30% of the diastolic blood pressures were at that level. So these are students who are in their 20s. They are people who might be recruited to the military, and it has implications for our entire community. So this slide shows the kind of the ethnic breakdown. The healthiest were the Caucasian group with only 40% of overweight or obesity, and the ones who were the other ethnicity were the worst group with, I think, 70% of overweight or obese. So we took this we took this information to the President Shirley Raines at the time, and she was very concerned and said, we need to do something to create a healthier campus environment for our students, faculty, staff, and visitors. And coupled with the fact that in 2012 it was going to be our centennial anniversary, she wanted to have something to kick off to show that we cared about the community. So she charged a group of us to come together, and we decided to provide environmental and normative support for healthier eating and increased physical activity on campus. And we wanted to collaborate with all the institutions, all the subgroups on campus, because it wasn't enough just the School of Public Health or the Lowenberg College of Nursing. It had to be community-wide, campus-wide, with organizations and vendors. And the most important vendor was our Aramark Campus Food Service, because they were the ones who procured the food, served the food, and they were our source of food for campus. And with physical activity, we wanted to feature convenient, enjoyable activities, venues, taking the stairs, walking trails, and even the College of Business had a wonderful idea. They had their stairwells lighted well. They had colorful paintings on it, and it was really very attractive and encouraged people to take the stairs. And the fourth thing is to promote shared responsibility. Memphis Healthy U had a double entendre. Memphis Healthy U for university, but also Memphis Healthy U for an individual. So these are our partners, the initial set of partners. We also added the Alumni Association counseling and other ones too. But when the President's office and the Provost's office said, we want you to do this activity, the faculty will listen. When the Vice President of Student Affairs said, this is important to us, then her staff joins the effort. When Human Resources puts this as a priority, the staff pay attention and want to get involved. Business and finance goes across the whole infrastructure of the university. And then here are the three academic institutions: School of Public Health, School of Nursing, and Health and Sports Science. The Student Government Association was involved, heavily involved. We were grateful for that. Student Health Services, Tiger Dining, athletics, but I think the most important contributor was the communications and marketing department, because they were the ones who came up with the strategic plan, the rollout, the look, the feel, and the marketing efforts. So this is just a snapshot of how we rolled it out in the summer and fall of 2012. We had, did I go back one or no? Okay. So we had the website going live, new faculty orientation. We had weekly Zumba classes at the University Center, the tobacco policy rollout, and a bunch of fun runs. And this is our kickoff in the University Center. We had student ambassadors who led everyone else in Zumba. And you can see our mascot, Pouncer. And Aramark had a lot of signage. They had iPads that showed nutritional breakdowns. They had apps where you could look at other things. So they were on board with us as well. They had a feature of $5 Mondays, a healthy lunch. But this was something that was important to us. We wanted a healthy box lunch so that if organizations or colleges had lunches, they could order a healthy box lunch. And we asked them to price point it lower. The box lunches were running around $10.79, and for us they did $10.19, which I thought was very positive. And we had any sandwich with chips, fruit cups, and some vegetables and bottled water. And this was our signage for taking the stairs. Initially we had tigers take the stairs, and then the Office of Disability contacted us and said that's not being very sensitive to other people. So we said, what would you like us to say? And they said, tigers who can take the stairs. Within 2 days, we changed the sign. So that was 2012, and that was the year of our centennial, and President Raines retired. So we had a new interim president who was very supportive of Memphis Healthy U and said, you know, once a week Zumba is not enough. I want to see daily activities, physical activity on the mall. And we said, thank you. We're happy to do that. So he gave us 2 GAs, graduate assistants, and we had shared responsibility among the 12 colleges and the different organizations and different groups, so that on Mondays, the colleges would rotate having responsibility for it. School of Public Health 1 week, then College of Nursing, then we had the College of Engineering. So anyway, we had the college, all the different colleges on Mondays, and we had the Alumni Association, and et cetera. We had a variety of activities. In the first 9 weeks, we had over 1,500 participants and averaged 33 a day. So this is our interim president, Brad Martin, who is participating in yoga. This is the College of Communication and Fine Arts dance team. This is an activity by the Alumni Association to have something for the Guinness Book of World Book of Records. So they had the world's largest number of people doing sit-ups for 1 minute. And I realize that's not impressive to the military, but for us it was. So we had 403 people doing that at one time. Yeah. So then the Alumni Association also had a march affiliated with Veterans Day. We had a Veterans Day program, and afterwards the participants went on a march and walked to a different building to sign thank you notes to the troops. The Alumni Association also worked with to kick off Women's History Month with a march across campus to show solidarity, and this is how it came out. This is Tai Chi. And I wanted to share with you that the consumer habits changed somewhat from 2011 to 2013. The consumer habits trended away from pizza, burgers, and fast foods, and there was a 120% increase in the venues that had healthy food salads and wraps. Chip sales remained flat. Bottled water sales, let's see. Soda declined 22% in sales, and bottled water sales increased 27%. Candy bar sales declined 30%. And this is just a snapshot of the calendar that the GAs distributed with different groups doing different activities. And you can see here's the school, the academic institutions, but here the Army ROTC had some exercises and led the Memphis Healthy U the midday moves at that point. This is the signage 2014, And I wanted to share with you, in 2015, we obtained our permanent president, Dr. David Rudd, who's also supportive of Midday Moves, Memphis Healthy You, but you can see the signage change. So the bottom line is, when administrators change, when the top level changes, it sets the tone for the whole initiative. This is Memphis Healthy You 2016. We had made a music video. This was suggested by the students, a music video in the University Center. So these are some of the lessons learned, that administrative directive is important. Food service changes need to be cost neutral. I didn't mention that, but with all the changes in the food purchasing, the Aramark did not lose any revenue, and that was important to them, and that was important to us to keep them as a partner. It's important to identify champions, and in the words of public health, our mantra is start where the people are. Understand the perspectives of people, understand what they want to receive, and bring them in and let them be part of the initiative. And welcome diverse perspectives and tailor accordingly. So I encourage you to partner with university ROTCs if you haven't thought of that before, because if university ROTC members who will become officers, if they are made aware of a culture of health and adopt that, then when they come into the military, they will have that as their mindset. Consider developing a relationship with local colleges and work with schools of public health, American Public Health Association via the Surgeon General. So thank you so much. I appreciate it.